This study examines the association between relational sanctification and depressive symptoms as mediated by the communal coping of African Americans in both married and cohabiting relationships. What we did was we sought to address this gap in research that recognized the potential of religious-based constructs to alleviate the negative consequences of depressive symptoms, yet failed to understand how relational coping practices functions in this relationship. This study relied on the dyadic data of a total of 467 couples in which we had cohabiting and married couples. We gathered data using the revised sanctification of marriage scale. We adjusted the language in the scale so that it applied to cohabiting couples. We also used the communal coping scale and the major depressive inventory. Utilizing the common fate model, our analysis revealed that higher scores on the measure of sanctification were associated with more instances of communal coping. More communal coping was associated with fewer depressive symptoms, and communal coping acted as a mediator between relational sanctification and depressive symptoms in both partners. This manuscript is both timely and important for a number of reasons. Foremost, many African Americans look toward religion and to one another to cope with negative experiences, stressors, and mental illness. With an understanding that relational sanctification can ease depressive symptoms and work through communal coping to do so, we move forward the literature on the strengths of African American relationships relative to health outcomes. Future research should consider our findings. There exists a need for more studies on the role of religion in health outcomes exclusively among African American couples. The lack of research on African American couples contributes to a limited understanding of how relational religiosity can promote health and well-being, and this study demonstrates the importance of dyadically considering how religious connection and cooperative action relate to depressive symptoms. From a clinical implication standpoint, clergy should recognize that there can be psychological benefits from pairing religiosity with professional treatment, and they should consider utilizing their relationships with African American couples to sometimes encourage professional help for those dealing with depression and depressive symptoms. For clinicians, they should consider the value of spiritually integrated psychotherapies for religious clients and couples, acknowledging that for many of these couples, spirituality cannot be separated from psychotherapy.